Have you ever felt like you're stuck in a loop of conflicting information when it comes to new treatments for erectile dysfunction? One day, you hear great success stories, and the next day, people claim those same therapies are overrated or even useless. My name is Dr. Jen Gunter, and I'm a board-certified urologist specializing in sexual health. Today, I want to cut through the confusion and share some eye-opening insights on regenerative treatments for erectile dysfunction. I'll also reveal how some of the latest technologies, such as platelet-rich plasma therapy, shockwave therapy, and electromagnetic treatments, are helping men reclaim their sexual vitality in record time. Before we dive into the medical details, let's start with a short story that may surprise you. When I was younger, the image of bodybuilders was starting to appear in popular media, especially in the 1970s and 1980s. I remember hearing so many dismissive remarks from doctors and scientists who claimed that anabolic steroids had little to no effect on muscle mass. The general public took these opinions at face value, and it became common knowledge that steroids were supposedly ineffective. Meanwhile, anyone actually using them could see otherwise. Of course, by the late 1990s, everyone knew that these performance-enhancing drugs were indeed powerful, and that their earlier dismissal was rooted more in skepticism and incomplete data than in actual facts. I've watched the same cycle play out with new therapies for erectile dysfunction, often referred to as ED. According to the Cleveland Clinic, ED affects approximately 30 million men in the United States alone, and the prevalence only increases with age. While conventional treatments like oral medications work for many, there's a growing movement toward regenerative medicine, which aims to address the root causes of ED rather than just masking symptoms. Yet a lot of my colleagues in mainstream medicine remain hesitant to acknowledge its potential benefits. One of the biggest game changers in this field is shockwave therapy for ED. Despite the fact that it's been around since about 2010, it still hasn't earned widespread acceptance in certain parts of the medical community. Some colleagues say they doubt its effectiveness, even though numerous studies and recommendations in the European Association of Urology guidelines support its value. Adding to the confusion, the FDA in the United States has not officially approved shockwave therapy for erectile dysfunction. Many of my patients are surprised by this, given how frequently this treatment is used in European clinics. So how does this therapy work? True shockwave therapy involves applying low-intensity acoustic waves to the erectile tissues, prompting a cascade of healing responses. Think of it like jump-starting your body's repair mechanisms, increasing blood flow and encouraging new blood vessel growth, both essential for getting and maintaining stronger, more reliable erections. Alongside shockwave therapy, platelet-rich plasma, often shortened to PRP, is drawing plenty of attention. This treatment is sometimes referred to as the P-shot. Essentially, a small sample of your own blood is drawn and spun in a centrifuge, separating out the plasma that's rich in platelets and growth factors. These growth factors, when injected into targeted tissues, can stimulate cell turnover and tissue regeneration. PRP isn't just a trendy buzzword. It's been used for years in sports medicine to help athletes recover from injuries more quickly. Over time, doctors realized that the same principles might boost sexual function by rejuvenating areas that are not getting optimal blood flow or nerve stimulation. Yet another innovative method is electromagnetic therapy, sometimes called extracorporeal magnetotransduction therapy, EMTT. This approach uses pulsed electromagnetic fields to stimulate cellular processes linked to tissue healing. While it's still relatively new compared to shockwave therapy, early research and clinical experiences suggest that it can complement other treatments, potentially leading to even better results when combined in the right way. Now, I know many of you are busy, or you live far from specialized clinics. One crucial obstacle has been the logistical challenge of scheduling multiple sessions for each treatment type: shockwaves, PRP, and electromagnetic therapy, often spaced out over several weeks. In response, forward-thinking doctors have begun to bundle these therapies into a condensed plan, sometimes delivered over just 3 days. From personal experience, I've noticed this approach greatly benefits men who travel long distances or prefer a more efficient course of treatment. But is this 3-day bundle just as effective as spreading out the appointments over many weeks? Based on what I've seen so far and what some of my patients have reported, the answer can be yes. Of course, it's never a 100% guarantee in medicine, but men who've undergone this compressed schedule have often mentioned a noticeable boost in their erectile function, sometimes within a few weeks of the final session. I believe that providing a solid block of regenerative interventions in quick succession may help jumpstart the healing process. If you're wondering why the broader medical establishment hasn't fully endorsed these therapies yet, part of the reason is caution. Regulators like the FDA want extensive, long-term studies on safety and effectiveness. And frankly, that's not a bad thing. Having rigorous clinical trials ensures that if and when these therapies gain formal approval, patients can trust that they're both safe and beneficial. However, there's also a level of skepticism that often accompanies any new or revolutionary medical idea. It takes time for new data to trickle through, journals to publish peer-reviewed articles, and experts to integrate these findings into practice. I saw something similar years ago with robotic prostate surgery. When the first reports about robot-assisted prostatectomies began emerging, many doctors considered it too experimental. Patients, in turn, were understandably hesitant. Yet after enough studies demonstrated better outcomes, like improved urinary control, fewer complications, and faster recovery, robotic surgery rapidly gained acceptance and is now the dominant approach in many parts of the world. When people see repeated proof of success, the conversation shifts from, "Is this legitimate?" to, "How soon can I sign up?" That's exactly the shift I'm seeing and expecting to continue in the realm of regenerative therapies for ED. Men who've tried these combined treatments are sharing their success stories, and it's only a matter of time before the broader medical community warms up to the evidence. To be clear, not everyone will benefit equally. Some men's ED may be related to underlying health issues, such as cardiovascular disease or poorly managed diabetes. If your testosterone levels are chronically low or you have a significant hormonal imbalance, you might need a different or additional treatment approach. The best outcomes often come from a coordinated plan that also involves lifestyle changes, like improved diet, regular exercise, and stress management. Now, I want to be totally transparent. I'm not a big believer in parading around cherry-picked patient testimonials because I know that what works for some may not work for others. But the pattern I've seen is encouraging enough that I'm excited to keep offering these therapies. Like buying a musical instrument described as having a good sound, you only truly know once you experience it yourself. In many cases, the improvement in erectile function is profound, and the shift in quality of life can be just as meaningful. I encourage anyone interested in these therapies to do your homework. Look up research from reputable sources such as the International Society for Sexual Medicine or the European Urological Association. Always ask questions during medical consultations and never hesitate to request real data on outcomes. If your physician dismisses your curiosity outright, consider getting a second opinion. ED is a deeply personal issue, but it's also a serious matter of health and well-being. I'd love to hear what you think about this emerging area of sexual medicine, especially if you have personal experiences with PRP, shockwave therapy, or electromagnetic treatments. Have you come across any success stories or studies that caught your attention? Are you intrigued but skeptical? Let's keep an open dialogue because sexual health is far too important to let outdated assumptions keep us from exploring innovations that can make a real difference. If you haven't subscribed to our channel yet, I'd love for you to hit that subscribe button and tap the notification bell so you never miss our latest updates. Your support means the world to us. If you find this video helpful, please give it a thumbs up. It really helps share our message with a wider audience. I'm excited to hear your thoughts on today's topic. If you enjoyed the content, type yes in the comments below. If it didn't resonate with you, let me know by typing no. Your feedback is incredibly valuable and helps me craft videos that better suit your interests. This field of regenerative medicine is evolving quickly, and I promise to keep you updated as new studies and technologies become available. You never know. By this time next year, we might be talking about an even more advanced approach that makes today's therapies look basic. Until then, remember that taking care of your overall health, heart function, hormone balance, and emotional well-being is often the best starting point for tackling any form of erectile dysfunction. Stay informed, be proactive, and always advocate for your sexual health. You deserve the best that science and medicine have to offer.